Hey there, this is Dr. Tall Paul Simon, psychiatrist. Please subscribe to this channel so that I can give you more and more common sense mental health tips and techniques from a psychiatric perspective. This video is a little bit about what to do when your psych meds aren't working. So antidepressants are one of the most commonly prescribed medications in the world. Most psych meds are prescribed by primary care doctors, who are not specialists, okay? So they have a lot of expertise in a lot of different subjects, but sometimes they're not an expert in any given one subject of medicine. So they may or may not have the background to prescribe psych medicines really, really well. So same thing with cardiology medications or endocrinology medications or different things like that. So with psych meds, there are several key concepts to remember as a prescriber, but also as a patient or somebody who takes psych meds, okay? So if, let's say, you're taking an antidepressant, for example, or a mood stabilizer or something like that, or an anxiety medication, and it doesn't seem to be really working, there are 2 or 3 main causes why the medication may not work. Okay, this is assuming that you tolerate it pretty well, all right? But it's just not doing what it should. So according to studies, the 2 main reasons why a medication such as Prozac or fluoxetine or sertraline or Cymbalta or these different, some of these different anxiety, depression medications may not work is number 1, that the person does not take it long enough to let it work, okay? So for any adjustment or starting on one of these medications, it can take 2 weeks or more to even start working. So that's a while, and people suffering are impatient naturally, and want it to work very quickly. But it does take a few weeks to even start working, and maximum benefit can take a month or 2, sometimes even longer. So it takes a while to reach peak efficacy on these medications. So the time that you're taking them really, really matters. The second key concept with these medications is that the person sometimes may not be taking enough to make it work. So let's say you're starting fluoxetine, which is Prozac, used for a lot of anxiety disorders, as well as depression. Start on a low, modest dose, 10, 20 milligrams a day, and you're taking it for a month or 2. That's long enough to see if it's going to do something at that dose. But if it's not doing anything, maximum dose is 80 milligrams. So a lot of times I see people prescribe these medications at a low dose and they're taking it properly every day and have been taking it for a while, but it just doesn't seem to be doing much, if anything. And they grow desperate and they give up on the medication. But unfortunately, the medication never got titrated properly. So it may be a perfectly good medication. They're not allergic to it or whatever, and they seem to tolerate it pretty well at a low dose at least. But it never got titrated up to the proper dose. So one way to think about this idea is, let's say you're marinating a piece of meat, a piece of chicken or tofu or something like that. You have to put enough spices and things and liquids in the marinade to flavor the chicken or whatever. But you also have to let it soak in long enough, maybe overnight even, in the refrigerator, to really get that marinade to permeate the chicken. So in this case, the medication is the marinade and your brain is the chicken, okay? So the amount and the time that it takes can often fall short. So keep those 2 concepts in mind, okay? Another idea that is behind failures in medication, I'll talk in a second video relating to medication failures, okay? So please watch that video. Please subscribe to this channel. You guys take care, okay? Bye.